Hi everyone, my name is Miriam, and in this presentation I will discuss the response adaptive randomization, also known as RAR. I would like to start with a motivating example. So as you all know, a maternal to child transmission of HIV is frequently transmitted during gestation, labor, or postpartum via breastfeeding. And those infants usually suffer from the following conditions, such as low birth weight, recurrent infection, progressive neurological impairment, macrocephaly, which is in babies with a small head, delay in achieving developmental milestones, mental confusion, abnormal enlargement of the liver, and many other devastating symptoms. The following clinical trial done by Connor and his colleagues actually evaluated the drug azidotimidine, also known as AZT, in reducing the risk of maternal infant HIV transmission. So in their study, they did a 50-50 randomization scheme by assigning 239 pregnant women to the AZT group versus 238 pregnant female to the placebo group. As you can see on my screen, from the AZT group, 20 HIV positive infants were born, and in the placebo group, we had about 60 HIV positive infants. Considering the seriousness of the adverse events of this clinical study, it would be unethical to use the 50-50 allocation. Based on the outcome which favors the AZT treatment group, the allocation probabilities should have been shifted from the 50-50 randomization scheme to weight of evidence for AZT drug. This is where a response adaptive randomization will come handy. This is a procedure that uses outcome of the study with the objective to maximize the power and minimize the expected treatment failures. It is desirable to randomize more patients to the superior treatment groups, and this can be accomplished by increasing the probability of assigning a patient to the treatment group when the evidence of the response rate increases in a group. The response adaptive randomization rule can be randomized play the winner, also known as RPW, instead of that 50-50 randomization. So for that clinical trial, instead of dividing the patients into two groups, they could do they could assign 360 patients to the AZT group and also 117 patients to the placebo group. Little bit of introduction background about the response adaptive randomization. So response adaptive randomization trial design uses the outcome data from the participants who are already in their trial in order to adjust the ratio of the participants that are assigned to each trial arm by favoring the better performing treatment. This picture actually represents the overall process of response adaptive randomization. As you can see on the left-hand side, the patients are randomized into 5 initial arms. After the trial started, they observed, and the outcome has been evaluated. And based on the response adaptive randomization, whether they can drop the inferior arms, early stop off the trial, or adjust the sample size. So from the left-hand side to the right-hand side, the sample size has been adjusted. The patients have been regrouped in order to have a better outcome. So what is adaptive randomization, and why is it so important? Clinical trials are experiments or observations that are naturally multi-objective. For example, one of the objectives is to have minimum sample size and maximum power. Another objective is to reduce the patient's exposure to potentially toxic or harmful treatment. Another one could be the cost of the study that may affect the large sample size. And lastly, strong desire to minimize exposure of patient to the less successful or more harmful treatment arms. Clearly, it is very difficult to design a study that is capable to cover all objectives. Once the study objectives are formally quantified and ranked in the order of their importance, an experimental design problem is to find a design that provides several selected design criteria. In addition, the treatment allocation are unbalanced across treatment groups, and they depend on model parameters that are unknown. Therefore, adaptive randomization is a great method to update randomization probabilities to target the allocation criteria based on the occurring information. It also makes it possible to discover and rectify inappropriate assumption in the trial design. So overall, the adaptive randomization design allows modification to some aspects of the trial after its initiation without undermining the validity and integrity of the trial. Thank you so much for your time.